So we're here at the ballet bar. We're going to do a internal and external hip rotation. The idea is to create tension in the fascial lines and then try to create internal or external hip rotation against resistance. So the effort is to try to turn the hip in and then out with the toe position countering it. So if you look at my feet, first of all, I'm always going to create my short foot. So as I get myself angled here, I'm going to create my short foot by tightening the arch of my foot and then pushing long, lengthwise, down into my toes. Not clawing with my toes, but trying to push them flat down into the floor. I'm going to toe in here first. I've got my short foot, and I'm pressing down on my toes. My pelvic floor is engaged. And as I have my toes turned in, pigeon-toed, I guess, I'm going to try to pull my heels toward each other, but my feet are glued to the floor. And I start to get this nice kind of dull, straining sensation in the inner part of my thigh, the high medial part of my glute, and high medial hamstring and some of the adductors. So you're going to hold this for 2-3 minutes. If you can facilitate some cramping in here, all is the better. If I go the other direction, I'm going to toe out as much as I can, create my short foot, my pelvic floor is engaged, and then I'm going to turn back, trying to pull my toes together in this fashion, and I get really, really nice stress and strain, especially on my right side. I got a history of right SI joint, which is now resolved, but you can feel a little bit of that residual weakness in that adductor on this side, these internal hip rotators. And again, 2-3 minutes with that short foot. If I can get a little teeny bit of cramping, I'll never get a cramp in here now. I've unraveled that. Making sure that glutes are always engaged during this process. So glutes on, short foot, pulling the toes in, and then pulling the heels in. 2 or 3 minutes each.